Are there any targeted treatments or serum which can help people achieve that quote unquote glass look?
So I'm not sure about the glass look, but definitely we prescribe targeted serums or ointments or creams to people who have some problem on their skin. Suppose somebody is having dry, flaky skin, then we would definitely like to prescribe hydrating hyaluronic acid or barrier repair ceramides to them. And also the vitamin C along with hyaluronic acid will take care of the brightness of the face and glowing skin in the daytime. So if you ask me, what is that which somebody should use during the day and one thing to be used at the night, and it would fulfill the day cream and the night cream. So that single thing to be used in the day is vitamin C along with hyaluronic acid. It will help you for the day. And for the night, you need to have a night cream which contains retinol. So if you combine both of them during the day, during the night, you are done.
Which are some of the targeted treatments like hydrofacial or such things which can complement your skincare routine? And is it important to tell your doctor about the ingredients you're putting on your skin before going for one of these
Absolutely,
treatments?
absolutely. It is very essential that you tell your doctor what all things you are applying during the day, during the night, what all products you are putting on your skin, so that we know how your skin is at the present times and what all you are using. Because if we suggest you any, say, hydrofacials or any chemical peel treatments or any microdermabrasion, which is skin peeling, or any such therapy, we need to know what all things you are applying so that there is no, interaction between the two.
Let's take this on a step-by-step basis.
Yes.
So let's start with microdermabrasion. What is something that a person cannot be using if they want to undergo a microdermabrasion?
So if I say in a nutshell, if you're using retinol, you need to stop it, say 48 hours, like 2 to 3 days before you come for any skin procedure, to be on the safer side. Because if you're using retinol, then your skin healing becomes slower. And if we are doing any procedure, we would like the skin to heal and, get better very fast. So stop it for 2 days and then come for any procedure. And, pardon, what else you asked?
Let's say you're doing hydrofacial.
Yes.
What do you need to be on the lookout for?
Yes. So hydrofacial is something which is very superficial. So you see, whenever we do a procedure on the skin, it is either very superficial or medium depth. We never go, deep procedures. We never do that. So hydrofacial comes on the very superficial things. Very superficial means it remains on the corneocyte level, on the upper epidermis. We do not come to the lower epidermis also, upper epidermis. The dead cells is removed. So hydrofacial mainly has those 3 serums which we try to infuse in the skin layer so that you get a glowy face, a smoother face. But along with that, we can incorporate microdermabrasion skin polish also, and various other masks which are whitening masks. And according to the skin type, we can choose anti-sebum things or hydrating things. And then to, complement with that, we can use a carboxy mask which gives you instant brightness. So all that can be done together. And the basic thing is that any active ingredient should be stopped around 2 days back. And we should know whatever you are using.
We've heard a lot of things saying that sunscreen can help protect you from skin cancer, or that sunscreen is the only way and the most important way to stop your skin from aging. Is there any truth to these facts?
So let me answer one by one. First, you asked sunscreen can help us protect from skin cancer. So you see, there have been studies in which we have found out that sun is a major source of problems in the cells, which directly points towards the nucleus of the cells, and it may lead to skin cancer. So yes, sunscreen is required to decrease the effect of UV rays on skin. But then coming to your next question, sunscreen is not the only way. So once you want to help yourself, you do not want any damaging effect of UV rays, you need to put a sunscreen. You also need to reapply that sunscreen depending upon whether you are outdoors or indoors. If you are indoors, you may very well reapply after 2 to 3 hours. So what I write on the patient's prescription, it's usually like, suppose they move out of their house at around 8:30. So I write 8 o'clock, 11 o'clock, and then 2 o'clock. After 2, usually after 2 to 3 hours, the sun is down. So you need to reapply. If you're outdoors, you may even need to reapply after every 2 hours or 1 hour also, depending upon the extent of sun. Okay. So sunscreen along with your glasses, wide brimmed glasses, then your wide hat. And also if you are applying a cloth, India में it's very common. लोग कपड़ा बांध के लड़कियां चलती हैं आराम से. So that cloth should be white, thick cloth. जिससे आप ऐसे देखो सन के अगेंस्ट तो आपको लाइट नहीं दिखे. So it should be opaque enough to not let you see the sunlight. So that thick white opaque cloth should be applied. You can tie around your lower half of face along with upper half, and then you are done.